Hey, my name is Megan Gardner. I'll show you a picture of my license. Here's a picture of my badge. I'm going to be doing an assessment on my mom. Her name is Debbie Gardner. So she's just going to give consent for me to do it.
I give my consent for her to do this assessment.
Hey, Miss Gardner. I'm Megan. I will be your nurse today. How are you?
I'm good.
Good. I'm just going to be doing an assessment. It's basically what that means. I'm going to take a listen to your heart, your lungs, feeling your pulses. I'm also going to be assessing your skin, your hair, and your nails. Okay. Is that okay with you?
Yes.
The first thing I'm going to do is I'm going to assess your hair and then kind of go in systems after that.
Okay.
Sound like a good idea?
Yeah.
Alright. And throughout the whole video, just for the purpose of this, I'm just going to be kind of talking, saying what's normal and what's not normal. So you'll hear me talking and kind of things like that. Okay. Well, your hair shows appropriate hygiene. It's very thick, and it's appropriate. So now I'm going to assess your scalp. Can you look up for me? Alright. Scalp looks healthy, shows appropriate hygiene, no lesions, and it looks good.
Okay.
So the next thing I'm going to assess is your skin. I'm just going to look at your arms and then your legs.
Okay.
Okay. Alright, your skin is moist. It's non-tender, no lesions, no masses, shows appropriate hygiene. Now I'm going to look at your legs, okay? Alright, your legs are nice and warm. Appropriate hygiene, no lesions, no mashes, and skin's intact. So the next thing I'm going to assess is your nails.
Okay.
Okay? They're round, they're symmetrical, they show appropriate hygiene. Let's see both of them. There's no clubbing, no cyanosis, which is good. So I'll take a look at your feet. I'll do the same thing. Feet are nice and warm, skin's intact, no cyanosis, no clubbing, nails are round and nails are symmetrical. So now I'm going to assess your lungs. So if you could sit up for me. Alright. First thing I'm going to do, I'm just going to watch you breathe. Okay?
Okay.
Her trachea is midline. No issues with that. No cough. She's not using her accessory muscles to breathe. Rate is regular. Rhythm is normal. And she seems to be having no difficulty with her breathing. So now I'm going to take a listen. And if you could, take a deep breath whenever I tell you to. Okay? Take a big, deep breath in. And then let it out. Good. Deep breath in, then out. Good. Deep breath. Good. Deep breath again. And then one more time. And let it out. Good. Well, our lung sounds are clear throughout auscultation. No adventitious breath sounds. Didn't hear any crackles or anything. Lung sounds are very clear, which is very good. And so now I'm going to feel your chest roll, and you tell me if it hurts or not. Does it hurt?
No.
Okay, good. Now what I want you to do is lay back for me, and I'm going to take a listen to your heart.
Okay.
Okay? First of all, I'm going to listen to you with you laying like this, with you sitting up, and then laying on your left side.
Okay.
Okay? S1 and S2 heard. Aortic and pulmonic. And the mitral valve. And the tricuspid valve. Alright, so if you could roll over to your left side. Can you scoot towards me just a little bit so I can reach you? Okay, good. And take another listen again to the same places. I don't hear any bruits, no murmurs, no gallops. S1, S2 again in this position. Everything's sounding good. Alright, so if you could just raise up again for me. Now listen to your heart this way. This one is 2. Aortic and pulmonic again. No bruits. No murmurs, no gallops. Okay, good. Now I'm going to assess her carotid arteries. You can hear her pulse just fine, no bruits, no pulsations. Good. Right now you can lay back for me. Also no JVD, which is also a good sign. Now I'm going to assess all your different pulses. Okay, first I'm going to start with your arms and then work down to your feet.
Okay.
I'm going to assess her brachial pulse first. It's strong and 2+. And do the other side. It's strong and 2+ as well. I'm going to assess her radial pulse. It's strong and 2+. And that's strong and 2+. Okay. Now I'm going to assess your femoral pulse, if that's okay.
Okay.
That's strong and 2+. And that's strong and 2+. Right, now I'm going to feel for your popliteal pulse. And that's strong and 2+. And then the dorsal pedis. Oh, excuse me, dorsal pedis would be down here. Post-tib was what I just felt. So these two are dorsal pedis. And they're strong and 2+ bilaterally. This is a post-tib. And they're strong and they're 2+ bilaterally. Alright, now I'm going to take a look at your legs. Do you have any pain in your calf at all on both sides?
No.
They feel fine? Okay, good. The reason why I'm asking you that's just assessing for signs of a DVT or a deep vein thrombosis. And her legs are nice and warm on both sides. They don't show any edema, no redness or swelling. If she did, then that would be a sign of a DVT, but I'm not seeing anything, so that's a good thing. Alright, now I'm going to assess cat breathe feel, less than 2 seconds, and breath. And then assess cat breathe feel, less than 2 seconds, and brisk. Okay, good. Now I'm going to assess your stomach, and that's going to be the very last thing that I assess. First, I'm just going to take a look at it. Just for the purposes of this video, I'm not going to lift up her shirt just for privacy reasons. So I'm just going to be looking on the outside. And I'm going to take a listen, and I'm going to feel. Okay? Does that hurt at all when I press down on it?
No.
Okay, good. Alright, abdomen is soft. It's non-tender, non-distended. It's flat upon inspection. It doesn't hurt at all when I palpate. Don't feel any masses. No palpitations. Nice and soft. And non-tender. So now I'm going to take a listen and see how you sound.
Okay.
In the first quadrant, she has positive vowel sounds, no bruits. Second quadrant also has positive vowel sounds and no bruits. Third quadrant has positive vowel sounds, no bruits. And the fourth quadrant has positive vowel sounds, no bruits. Okay. Alright, well that concludes my assessment. Is there anything I can get for you while I'm in here?
No, thank you.
Okay, well you give me a call if you need me, alright?
Okay, thank you.
Well that concludes my visit. Thank you very much.